Hi everyone, I'm Tori and welcome back to Tori's Takes. And this week's graduate medical education topic that I'm just going to kind of impart a few words of wisdom on is the ACGME resident and faculty surveys. So we're kind of entering that survey time of year in the GME world, and to kick it off are the ACGME resident and faculty surveys. I know a lot of programs and institutions do some internal surveys towards the end of the year, and of course that will be coming up in a few short months. But the ACGME resident and faculty surveys actually opened up about 2 weeks ago in mid-January, so some programs are already in their survey window, and if you have not received notification yet, of course you will be shortly. So let's talk a little bit about the importance of the surveys, and they have gotten more important in the ACGME's next accreditation system. And that's because the ACGME or the RRCs are now making annual accreditation decisions on the programs. And a big part of the data that they look at in order to help them make those accreditation decisions are the resident and faculty surveys. So those are something that you should be taking seriously. You should absolutely be encouraging the residents and faculty to take the survey, going over the surveys, really looking at the results, discussing it with your residents and faculty, and creating action plans on the survey results, as well as incorporating into your annual program evaluations, of course. So what can you do to prepare for the surveys? Well, the first thing is to talk to your residents and faculty about it. I find that a lot of programs feel like that's kind of taboo, but it's really not, as long as you go about it in an ethical way. And I think by telling them the importance of the surveys, just as I described with the annual accreditation decisions and how the ACGME uses and looks at the survey, that's important for your residents and faculty to know. So, certainly kind of go over that with them. The other thing is to share with your residents and faculty the improvements and adjustments that you've made over the past year as a result of the survey results. Of course, that's if you're not a new program and you have survey results to look at from the previous year. And also looking kind of at trends. So it's really important because not all of your residents and faculty are going to be part of improvement efforts in certain areas based on the survey results. And so while you may go over the results with your residents and faculty, some of them may actually have no idea what you actually do with those results and the different initiatives that you put in place as a result of the surveys. So it's really important to discuss that with the residents and faculty. And right before your surveys are getting ready to open up for this year, that's really the time that you can do it. And then also make sure that you advise your residents and faculty to be honest and take any personal feelings, out of it when they're completing the surveys. It should really almost be they should be answering the questions as if it was like a fact-finding mission. I think we all can relate to having some negative experience that really affected our perception of the experience, the total experience. And I think that can be the case too with these surveys, that residents you may have a disgruntled resident, or they may just have negative perception about one aspect of the program, but then because of that they're rating things on the survey a little bit lower. And so I think reiterating to the residents and faculty that to please answer with honesty and integrity, and really just address the facts. A couple other helpful hints. It's a good idea to do some pulse checks, mini surveys throughout the year based on some of the lower scoring areas of your ACGME resident and faculty surveys to really get a sense of, is the perception changing of the residents? Has the program done enough improvement and implemented enough changes to change the residents' perception and truly make it a better experience, depending on what it is that you're looking at. And I would also highly advise you that in the program's annual update, to document how the program has been working on lower scoring areas of the survey. And the reason for this is that if you don't do that, all the RRC is going to see is the survey results and the lower scoring areas, or the areas that you have trended downwards in the past year or two. So I think being able to provide an explanation, as well as, you're acknowledging some of the lower scoring areas, or you're acknowledging some of the improvements, and letting the ACGME know what you've done to address those areas or what you intend to do to address those areas, really paints a whole picture for the RRC, not just looking at the survey results. So that's all that I have on the ACGME resident and faculty surveys. Happy survey season, and I wish all the programs the best of luck in their surveys. And of course, we have to wait several months for the results. So happy survey season.